Good afternoon, everyone. My name is Melissa Lopez Varon. I work at MD Anderson Cancer Center in Houston, Texas. I am a program director and co-leader of our project Echo Superhub for Oncology at MD Anderson Cancer Center, where we focus on training other centers in using the Project Echo model for oncology. And today I'm joined by my colleague, Dr. Ellen Baker, who is going to introduce herself and start with our presentation for today. Welcome.
Thank you, Melissa, and welcome everybody and good afternoon. Like Melissa said, my name is Ellen Baker. I'm part of the MD Anderson Project Echo team and Project Echo Superhub team. And we have a small and enthusiastic Echo group at MD Anderson. Our leader is Kathleen Schmaler, a gynecologic oncologist who was very instrumental in bringing the Echo model to MD Anderson. Mila Salcedo, who's our Director of Training and Education, a gynecologist from Brazil, very active in many of our echoes, particularly those that involve the Portuguese language. And then Jessica Rodriguez, who's our program coordinator, and as those of you who do echo know, this is the person who keeps track of those hundreds of emails and questions and invitations, etc. So we're extremely grateful for the work that Jessica does with our ECHO team. So we have been members of the Meta ECHO community for about 7 or 8 years now. The way it started was that Dr. Aurora was invited to do grand rounds at MD Anderson, and he actually came twice in 2013. And those were the early days of ECHO. That was just shortly after his article was published in the New England Journal of Medicine. And Dr. Schmaler and Dr. Hawk kind of had a vision of how ECHO might be a good tool and a good model for us to use, particularly in cancer prevention at MD Anderson. So a small number of us went to ECHO training in 2013 and 2014 and just jumped right in and started our very first ECHO in April of 2014. At that time, we had quarterly meetings and we invited faculty from MD Anderson to attend to learn about the ECHO model, to learn about how it might be applied and how it might support some of the projects that they did. And little by little, over the course of a year or two, it really took hold. So our first program in April of 2014 was to support a cervical cancer prevention program that we ran with partners in the Rio Grande Valley along the Texas-Mexico border. And following that, we had our tobacco treatment team pick up the ECHO model and start using it to support tobacco treatment programs that they had around the state of Texas. And like I said, little by little, other faculty members picked up the ECHO model and began to use it in some of their programs. So to date, we've had, I think, 16 programs using the Project ECHO model, and I think we currently have maybe 13 of them that are active. So after this first couple of active years, we were invited by Dr. Aurora to be a super hub with a focus on oncology. And so in addition to being one of the early users of Project ECHO, we were one of the first oncology centers to use Project ECHO in the cancer space. In cancer care, ECHO is generally not a standalone intervention, and it's part of a larger strategy, but it's a really important part of a larger strategy. We do a lot of education and training events, both in the US and around the world, and we use the Project ECHO model to amplify and to sustain a lot of our in-person events. We do a lot of hands-on training involving surgical training and procedural training. We work in health system strengthening. We've got projects that include advocacy and support, and also even development of the capacity and capability to do research. And particularly for our partners that we can't visit that often, for example, partners in Africa and partners in Asia, not only does ECHO serve as a forum for improving knowledge and sustaining the gains and the improved processes that you develop in person and ECHO events, but it is a great communication tool. And we have found that this is one of the most impactful and important parts of ECHO. We talk on a regular basis. It brings us all together. And I call it the glue that holds many of the elements of our program together.
Thank you, Ellen. We also wanted to share with you a few of our programs and where they are across the continuum of cancer care. As you see, we have a lot of programs for focusing on cancer prevention, specifically focusing on cervical cancer prevention, early diagnosis and early detection and early treatments. As Ellen said, our first program is a program for cervical cancer prevention with colleagues in Texas. It started with a few clinics in the Rio Grande Valley of Texas, and it has now expanded to about 13 or 14 different counties across our state, thanks to funding from the Cancer Prevention Research Institute of Texas, CPRIT. We also have a program for cervical cancer prevention with nurses in Cameroon that is run by one of our colleagues at MD Anderson. And as also Ellen said, we have a big program in Mozambique, and one of our Project ECHO programs is for cervical cancer prevention in Mozambique. The sessions in Mozambique are held in Portuguese. That's their main language, and that's why our collaboration with our Brazilian colleagues is so important and central to the success of that program. For other focus sites for prevention, we also have a program for early diagnosis of melanoma in Texas, and that has expanded to other states as well. The program is run by Dr. Kelly Nelson, and we have a program for tobacco cessation in Texas and the US that is run by our colleagues at the Cancer Control Platform. We have a big focus on treatment, and these programs, as you can see here in this slide, are all global. So we have programs for treatment of gynecologic cancers with a consortium of 13 countries in Latin America. Those sessions are held in Spanish, and it's a collaboration with the International Gynecologic Cancer Society. And we have programs for treatment of gynecologic, breast, and hematologic cancers in Mozambique, all ran in Portuguese in collaboration with our Brazilian specialists. And also we have a program for treatment of breast cancer in Gaza, and an educational program for radiation oncology with colleagues in Zambia, in Lusaka. There's a program for palliative care that is run by our colleagues, Dr. Genuine Reddy from Palliative Care at MD Anderson, and it's also a consortium of about 7 countries in Africa. And then we have 2 programs focusing on survivorship. One is a program that is currently existing, cancer survivorship for community health workers, to help patients continue to stay active after they get a diagnosis of breast cancer. And that program is run by Dr. Basunian Quest at the Behavioral Science Department at MD Anderson, and we have a program for cancer survivorship that is currently on a break and is historically being funded by the Cancer Prevention Research Institute of Texas. And we are very excited about launching our 2nd year of our program, focusing on helping countries in Latin America reaching their elimination strategy for cervical cancer. So it's a public health policy program that is still in its infancy, but we are very proud of it. And those sessions are held in Spanish, and it's a collaboration with the National Cancer Institute of the US and the Pan American Health Organization, PAHO. As you can see here in this map, we have colleagues in 27 countries in the Americas and in Africa. And to date, since 2014, MD Anderson has held almost 1,951 ECHO telementoring sessions, focusing on expanding knowledge and skills and supporting colleagues, about 2,630 providers from 27 countries. So we are very, very proud of our reach, and also very excited of seeing how things grow in the coming years. In terms of our role as a Superhub, currently we are holding this week the 16th immersion training that started in 2017 when we became a Superhub. 6 of these have been held virtually. So historically, we would have 2 trainings a year. And during the COVID pandemic, we actually picked up. So a lot of people are getting excited and interested in using Project ECHO for oncology. We have trained 332 participants from 52 institutions, joining us from 13 countries. And that includes colleagues in Ecuador, Brazil, Mozambique, and other places globally, Nepal as well. We have organized these trainings in Portuguese and Spanish, also focusing and collaborating with other Superhubs and just focusing on the needs of our colleagues. Most of our programs have that have launched are focusing on oncology, but we also have trained historically colleagues from the UT system, regardless of their area of focus, and other Texas partners. And just looking at the future for us at MD Anderson, we want to continue to sustain our growth rate, continue to provide high quality training. So we are constantly innovating, focusing on addressing the needs of our partners, even thinking about how learners engage with us virtually, which has been a big challenge, but also a huge learning curve for us. And also continue to offer trainings twice a year and collaborating with others. So with that, Ellen and I want to congratulate UT Health Superhub for exciting this wonderful journey. And of course, we are here to support in any way you need. And thank you so much for the invitation again.